A new study published in the medical journal Heart suggests that adults who lose their teeth to gum disease and cavities at an early age may have an increased risk of heart attacks later on in life. NJN News health and medical correspondent Sara Lee Kessler has the story.
7, 5, 12.
The study adds to a growing body of evidence linking poor oral health to heart disease, specifically to the bacteria that cause gum disease and tooth loss.
The bacteria has gotten underneath the gum and literally eaten away the bone.
Dr. Thomas Giusto, a Springfield periodontist, tells his patient,
we'll have to get you a replacement tooth for that.
But apparently the bigger concern with gum disease is heart attack, the #1 killer of men and women in this country. Dr. Giusto says the study should be a wake-up call.
Once the bacteria get below the gum into crevices and the bacteria elicit all of their byproducts and toxins throughout the bloodstream, it sets off a cascade, putting you at a higher risk for heart disease, and it could be spreading to the heart.
The study involved 12,000 British adults who were followed for up to 50 years after college.
Patients who had lost 5 or more teeth were 35% more likely to die from heart disease versus patients who had lost less than 5 teeth.
If you count wisdom teeth, the adult mouth contains 32. Alan Moore has lost 19. How concerned are you that this could lead to heart attack?
Very concerned, since I've got 2 young children and a young wife, and I'd like to spend a lot of my life with them.
Tina Russell has lost 11, the first when she was still in high school.
It's very frightening, and I'm just glad that I, started to get the proper dental care.
Teeth can often be salvaged with deep cleaning, scaling, gum surgery, and in this case, adding synthetic bone to replace what's been lost. But experts stress the importance of good home care and semi-annual dental visits. Sara Lee Kessler, NJN News, Springfield.
State racing regulators have adopted tougher drug testing policies aimed at curbing doping in the horse racing industry. The New Jersey Racing Commission adopted a plan that will allow surprise random testing of horses. The goal is to find blood doping agents that cannot be detected in the state's current tests administered to horses.
The way in which all of the scientists and experts have indicated to us is to randomly test in advance of race day, out of competition. They do this in other sports. They do this in the cycling world. They just show up and ask for a blood sample. That in and of itself will be a deterrent, we believe. It will also give us a better opportunity to identify those individuals who may be using this substance.
The new regulations are opposed by horsemen but requested by officials running the Breeders' Cup. Coming up in business news, the Fed makes a move that sends the market soaring, and a piping company dedicates a new facility in South Jersey. Business news is next. Stay tuned. In business news, the Federal Reserve today cut a key interest rate. The Fed slashed the federal funds rate 0.5% to 4.75%. That's the rate that banks charge each other. The cut was twice as deep as many economists had been expecting. It's aimed at boosting economic growth by lowering borrowing costs for millions of consumers and businesses. Well, stocks reacted strongly to the Fed's move. The Dow Jones Industrial Average